So deep dive into iron deficiency anemia. Now, we've got to understand iron deficiency anemia in adults. Okay, iron deficiency anemia is a major global health issue. Remember, the objective said it's a common thing, especially in females of childbearing age and individuals in low socioeconomic countries. So those are two risk factors: females of childbearing age, people in low income countries. Now, this presentation will focus on causes, diagnosis, and approach to evaluating iron deficiency anemia in adults, because there's a whole presentation we need to do on anemia in children. Okay, now iron deficiency anemia is more advanced stage of iron deficiency when low hemoglobin is present. So when you see a patient in your clinic and the patient has anemia and you do your blood film comment and the patient the picture is more of an iron deficiency anemia, remember that by the time the patient is actually presenting with symptoms of iron deficiency anemia, that means it's gone on for some time. It is more prevalent. Iron deficiency anemia is more iron deficiency is more prevalent than iron deficiency anemia. What do we mean by that? That means that there are people who have low iron who don't necessarily have anemia. Okay, there are people who have low iron who do not necessarily have low anemia. But let's not waste our time on that. Global statistics show that 1 in 5 females are iron deficient. So one of the key groups of people who are affected by iron deficiency anemia is females in the reproductive ages. Okay, females in certain racial groups such as Black. Remember that the objective was talking about it. So please note these ones down. Black, Hispanic, Native Americans have higher prevalence rates. So I'll just highlight that for you. I want you to write that in your notebook right now. Whatever it is that you're using to take notes, please. Even though we are talking, so for example, if I should ask, iron deficiency anemia is common in the following females except A, Caucasian, B, Blacks, C, Hispanic, D, Native Americans. Your answer should be Caucasian, right? We said it's prevalent in the following except, or it's common in the following except, so that is one thing you need to know, because the objective wants you to know it. So please write it down. Females in the reproductive ages who are Black, who are Hispanic, who are Native Americans have higher prevalence of iron deficiency anemia and iron deficiency in general than their Caucasian counterparts. Now, blood donors and pregnant women also have higher risks due to frequent blood loss. And how do pregnant patients lose blood? Bleeding in early pregnancy. So whether it is threatened abortion, incomplete abortion, complete abortion, septic abortion, second trimester blood loss, it could be early placenta previa, vasa previa, and especially third trimester, vasa previa, placenta previa, abruptio placentae, and even the blood loss during delivery itself. If they have a cesarean and maybe the physician is not skillful enough and the patient loses a lot of blood. So these are all things which come with it. Don't also forget that when they are pregnant, the baby also demands, a lot of nutritional value. And so some of the pregnant patients also lose a lot of blood. And what are some of the other major causes of iron deficiency? Blood loss. It is the most common cause of iron deficiency anemia, especially from the GI tract, or heavy menstrual bleeding. That is why we're saying that if you get a patient who is older, who has iron deficiency anemia, the patient has not recently had any motor vehicle accident, not had any reason why the patient should lose blood, think about GI loss. Number 2, decreased absorption. So like celiac disease, gastric bypass, okay? Long-term use of proton pump inhibitors like lansoprazole, like pantoprazole, like esomeprazole. So if you have a patient who has some form of gastritis and has been bleeding, like has been taking proton pump inhibitors for some time, they stand the risk of developing iron deficiency anemia. So let me go through it again. Absorption concerns, celiac disease, gastric bypass, long-term use of proton pump inhibitors. And I'll
Excuse
even
me.
go on to talk about, yes, please, who is speaking?
Yeah, it's Dr. Clary. I had a question.
Sure, please ask your question.
Yes. For the long-term use of proton pump inhibitors,
Yeah.
like what interval of time are we talking about? Is it I'm asking this question especially when you are doing your physical examination, in knowing what interval, what time should we be looking into if we are suspecting if there's a long-term use of proton pump inhibitors? Is it is it 6 months? Is it 1 year? How long should we?
The use of the proton pump inhibitors is not only dependent on the time, it's also even dependent on the dose. So, for example,
the use of the proton pump inhibitors is not only dependent on the time, it's also even dependent.
So, for example, let me take two patients. One is taking 40 milligrams of pantoprazole, the other one is taking 20 milligrams of pantoprazole, and they are all taking it over 6 months. The one taking 40 milligrams of pantoprazole is at a higher risk of developing iron deficiency anemia as compared to the one who is taking only 20 milligrams. So you can have, and it's also dependent on the person, but anything above 3 to 6 months, you should start becoming wary of it. And that is why in medications like proton pump inhibitors, if the patient has taken it for a very long time and probably it has dealt with the concern, the recent evidence shows that we have to start de-prescribing. De-prescribing means that you've got to go back to the drawing table and ask yourself, does this patient still need this particular medication? If the patient doesn't need it, you want to start tapering off and take the patient off totally. So anything above 3 to 6 months, you want to start becoming concerned about it, right? Good. And then low intake of iron-rich foods like heme and non-heme foods can also contribute to it. So the memory aid here is very simple. Always think about bad iron. So just write this down in your notebooks. Bad iron. And what are the bad iron? Bad iron is telling you about the major cause of iron deficiency anemia. So blood loss stands for the B. A stands for the absorption issues. And we've talked about it. Celiac disease, patients who have had gastric bypass, patients who are even using long-term proton pump inhibitors, and we even learned patients who are taking huge amounts of tea because of the ease of tanning, okay? And then diet issues as well. Other risk factors for iron deficiency anemia are blood donation. So patients who are regularly donating blood. Pregnancy, number one, because of the iron demand from the baby, it leads to high prevalence of iron deficiency anemia. And then dietary restrictions like vegetarians, they are also at a high risk due to the reduced heme iron intake, and as well as medications like proton pump inhibitors, NSAIDs. Remember that NSAIDs can affect the stomach lining, and we learned that the stomach, the duodenum, these are two places where iron is absorbed. And patients who take anticoagulants. Why? Because anticoagulants, they can bleed a lot. Okay, so the acronym for this one then becomes PDBM. That is pregnancy, blood donors, bleeding, and medication. So you should be able to talk to me about some of the medications which can lead to iron deficiency anemia: proton pump inhibitors, NSAIDs, anticoagulants. Okay, good. Now, what about the diagnostic evaluation in patients who have iron deficiency anemia? Usually, if you do blood work, you want to check
Excuse me.
of course, their CBC.
I'm
You want
sorry,
to
I have
know
another question.
who is this? Okay,
It's
please
Dr.
ask your
Clary.
question.
Yes. So I've noticed that in the diet section of the causes of iron deficiency,
Yeah.
vegetarians are cited, and
What?
sorry, I'm vegetarians,
Yes.
vegetarians, those who
Yes.
take vegetables a lot,
Yes.
they're cited in heme iron deficiency. So my concern
How do
is
that?
question on I'm sorry, it might look a little bit taking you backward, but then vegetarians are actually the vegetables itself are actually supplements. They can be one way of supplementing naturally iron. So how can vegetarians actually be, causing, how can it be the cause of iron deficiency? I'm sorry, it might look a little bit stupid as a question.
So the issue is that if you take plant-based sources of iron and you take meat-based sources of iron, it is known that pound for pound, the meat-based sources of iron are more than the plant-based sources of iron. So it's not like being a vegetarian itself is what will drive you to that. If you want to get the supplementation of iron as a vegetarian, then that means that those green leafy vegetables, you need to eat so much of it, right? And there are some vegetables which some vegetarians also take, which can at times affect even the iron supplementation, like what we were talking about, the tannins so far as tea is concerned. There are some vegetables like that. I don't have them off head, right? But plants and foods like lentils, beans, like green leafy vegetables, spinach, these contain good sources of iron. But you can also have some vegetarians who don't eat foods which have good sources of iron. That's all the argument we are making here. So it's not really that just being a vegetarian is that, but pound for pound, the amount of vegetables you need to take to get the iron you get from maybe liver, from the cow, or from the goat, or from whatever, at times you need to eat more. That's it. But if you want to know some of the iron rich foods which will help the vegetarian to get good source of iron, you can look at things like beans, like lentils, like green leafy vegetables, and they can also even get iron fortified foods like some cereals they take, and some tofu as well. So that is it. It's not like being vegetarian itself reduces iron absorption, but pound for pound they may not be getting enough vegetables which will compensate for the iron. That is why some vegetarians also take supplementation. So they may take some iron supplementation, they may take some multivitamin supplementation, just to make up for some of the things they don't get, right? Yeah. Okay, so let's continue. So the diagnostic evaluation, you realize that when you have a patient with iron deficiency anemia, what are the things you want to look out for? Ferritin level. In iron deficiency anemia, ferritin will be low. Then you also do your transferrin saturation. Then you do your hemoglobin, which is part of your complete blood count, and then you do your hematocrit, right? So these are the major things that you want to do to help you to make your diagnosis of iron deficiency anemia. Usually, ferritin less than 30 nanogram per liter, or a transferrin saturation of less than 20 are highly sensitive of iron deficiency. Okay, so if you want to look at the highly sensitive things which should cause you to think about iron deficiency, think about ferritin, and think about a transferrin saturation as well. Okay. So we still continue the causes of iron deficiency anemia. We are looking at causes of reduced iron absorption. Celiac disease. Why will celiac disease do that? Because it causes inflammation of the small intestines, and because of that, it impairs iron uptake. Remember, we talked about the role of the duodenum, right? The duodenum is the major part where iron is absorbed. And if you have celiac disease and the duodenum is inflamed, it will not be able to absorb the necessary iron you want. And then atrophic gastritis and Helicobacter pylori. These also reduce the stomach's ability to absorb iron. And then bariatric surgery. Remember that with bariatric surgery, at times they may take a portion of the stomach out, and some surgeons may even take a portion of the duodenum out. And remember that iron is absorbed in the duodenum and in the stomach, but mainly the duodenum. So if you have part of the stomach taken off, or you have part of the duodenum taken off, there's a problem. Okay, so these are the things you want to know. What about blood loss? We've already talked about it. If the patient has heavy menstrual bleeding, so think about wherever bleeding can come from the P, that's hematuria, heavy menstrual flow, pregnancy. We talked about all the various causes of bleeding in pregnancy, and then they can also bleed from the GI tract as well, whether it is malignant or non-malignant. And then occult causes like hidden GI bleeding from ulcers, hidden GI bleeding from GI tumors, even if they have parasitic infestations as well. These can all lead to loss of blood, which will lead to iron deficiency anemia. What about diet? As I talked about the issue with vegetarians and iron deficiency anemia, heme iron is found in meat and it is better absorbed. Okay, non-heme iron is found in vegetables and grains, and the absorption is less efficient. So that is why vegetarians are at that risk. And then people who also take iron inhibiting foods like tea. So that's why I dropped that question on tea, like whole grains, like calcium rich foods. These reduce iron absorption. And we talked about medications. Who can remind me of the medications which can lead to iron deficiency anemia? Can someone just remind me of the medications quickly, please? Medications, medications.
Proton pump
Lansoprazole,
inhibitors.
NSAIDs, anticoagulants, and
omeprazole,
and proton
PPIs.
pump inhibitors. Yeah.
Okay,
Non-steroidal.
NSAIDs, anticoagulants, proton pump inhibitors, and
Yes.
what else?
Non-steroidal.
And
NSAIDs.
NSAIDs. Beautiful,
It's, yeah.
beautiful, beautiful. Okay, then in cases like that, usually oral iron supplements are prescribed. Where you can give like ferrous sulfate is commonly prescribed, and IV iron will only be prescribed for individuals for whom iron absorption is an issue, or they cannot tolerate iron supplementation, because at times they take the iron, they develop very bad stomach cramps and very bad diarrhea, and people don't like that. So at times you may then go the IV route. And you may also encourage iron rich foods like the heme iron, especially from the heme iron sources. Okay. So the key takeaway here is that iron deficiency is common and often due to blood loss. Okay. And early diagnosis and appropriate management are essential. And dietary changes and supplements play a key role in managing iron deficiency anemia. So now let's end it there.